Okay, good night everyone. First, sorry I can't speak in Spanish, so lo siento, no puedo presentar en español. I hope you guys understand well. My English is not perfect as well. I'm from Brazil, so I'm fluent in Portuguese. I can speak a little Portuñol, but let's go to the talk and let's start. So I'm going to speak about recommendations for a curriculum in radiation oncology in Latin America. Thanks everyone for the invite. It's my pleasure to be here. I'll try not to keep you guys too long here. So let's start with my disclosures. They're not related to this talk. So first we need to understand that the burden of cancer is increasing, especially in Latin America. Some estimates shows that the number of cancer new cases and death are gonna double by 2040, and that cancer treatment is becoming more complex, and we need to understand it better to deliver better care to our patients. And for that, we need to develop a well-trained oncology workforce, and especially in Latin America, aiming to promote high-quality care to our patients in the years to come. However, we face a lot of challenges, and we have learned today from all the greater speakers before me that there is a lot of training differences between countries and specialties. There is lack of support, and I also want to bring that burnout has been a common issue lately in our field. Other challenges that we have is that there is lack of standard training in Latin America. There are high clinical demands in Latin America. For instance, I did my training in University of São Paulo, in São Paulo, and the number of patients that I used to treat there compared to any centers in North America was like at least 3 times higher. We have scarcity of resources in Latin America, and we have insufficiency supervision, some places with low salary, low appreciation, and sometimes we feel isolated from the world. So oncology and radiation treatment are changing, and the changes are very fast. There is great advance in technological developments. As we saw today, Dr. Philip presenting on the Flash RT. And our train in Latin America is not uniform, and research is also a big challenge. So most program, especially in my country, Brazil, we don't have like a formal curriculum for research, for innovation, or for new technologies, or for new drugs or career development. And leadership development is also a very good challenge, and it's great to see ACRO promoting leadership courses as the one that is led by ACRO and our colleagues from Australia like Sandra Turner. So we can only be successful here in Latin America if we succeed on improving the care of our patients, because the numbers are only gonna increase. We need to expand training and education. As we see, there's as we saw in the previous talks, there's need for more radiation oncologists because the population is growing, and there's already a lack of enough radiation oncologists in the region. And we need to promote adequate researches for the oncology setting. And how we can do that? We can start by creating a standard curriculum in radiation oncology, so the countries could communicate to all countries in the region. We can promote bidirectional learning, fellowships, and etc. And for that, together with many friends, including Benjamin Lin, that gave the talk on Zoom earlier today, we developed a specialty portfolio in radiation oncology, and that's especially to help us to build a global curriculum for radiation oncology, and also to help to certificate the future trainees. So we know, and I'm not going to spend a lot of time here, that radiation is an essential component on the treatment of cancer, neoadjuvant, radical treatment, adjuvant treatment, and palliation. There's a global gap on access to radiation, and also a global gap in the number of human resources. And to fill this gap, many institutions are promoting education and awareness about radiation, including ACRO, UICC, the International Agency, and the World Health Organization. However, we still have a lack of trained radiation oncologists in our region, and that's not only because there is lack of reports and recommendation, but there is lack on how to implement them, and also there's a lack of teachers in the ground. In addition to that, we know that some national authorities, sometimes they don't agree on how to certificate and how to promote training in radiation oncology in different countries, and that's also a big challenge. So we need to bring the authorities together because they will be the responsible for the eligibility of our trainees and to provide them certifications. And maybe in the future we could have an authority that will oversee the Latin America training and how our trainees will be working and promoting care to our patients. And then each certification will be potentially enabling physicians to work in our region and to promoting better care. And then, with all of that in mind, we developed this portfolio to try to transfer the existing recommendation for the training programs who are already established, so they can easily implement a competence-based roadmap based on what is already available. We don't need to create new things, we don't need to redevelop the wheel. So for the development of the portfolio, we have like 3 main focus. One is focusing on the training of our trainees, including the lectures and the practical training. The second part is managing workflow, and the third part is how to assess and how to evaluate our trainees. For instance, in Canada, we are moving from having a 5-year residency program, and now we are going for a competency-based training, where we are going to be assessing, and I'm going to show you how we assess that. We assess our trainees. As soon as they achieve their competency, they can move to the next stage. So some people are going to be able to finish the training in less than 5 years. And our mission here with this portfolio is to serve the patients, the public, and our medical professional, and bringing high standard to radiation oncology globally and in Latin America. We want to advance safety and quality, and we want to bring certification to our trainees. So how we can do that? So first, the CanMed, so a Canadian organization, promote the 7 roles that radiation oncology must possess, and also we have some activities, some forms that we can fill, 14 of them, to make sure that our trainees are achieving that. So we'll start by reviewing 4 of them here. So we're all expected to be medical experts, so medical experts in our fields. We are also expected to be good communicators. So most of our time, we are communicating with people, communicating with patients, or communicating with our colleagues. We need to be good collaborators. And now we also need to be good leaders because we need to push our field. We need to bring awareness to radiation and how radiation can impact on cancer treatment. We also need to be scholars and professional. So these are the 4 special roles that all residents and trainees must have. And then when we go for all these levels, we also need to measure how we are doing. So here we have the 5 levels of entrustable professional activities. So when you start as a trainee, you observe. So you're learning by observation. So second level, you start doing something under supervision. And then third level, you can have an indirect supervision. Level 4, you do without supervision. And level 5, you're already supervising your junior trainees. So you're getting to understand better what you're doing, such as taking a history, physical examination, a special scope, a brachytherapy procedure. So we start from observing until you're able to supervise others. And when we talk about infrastructure, we know that this is unequal in our region. We have places with access to newer technologies. We have places that have access to IGRT, VMAT, SBRT, SRS. We have places that are still like treating with cobalt machines, 2D radiation. So here we promote 3 levels. So a basic level. So the basic level is what everybody must know or at least learn at some point on their train, such as a 2D planning or how to use orthogonal X-rays and etc. I'm not going to go on the details here, but especially like basic roles of radiation therapy. The standard for us, and with that I agree with Dr. Portsman, we need to train our next generation to use CT SIMS, and we need to be focusing on contouring and like making sure that we deliver very accurate radiation. We know anatomy, we know how to contour, we know how to protect organs at risk, and that's important. And the third level would be the advanced level that is not available to everyone, but actually being able to have MRI, PET-CT, VMAT, RGRT, SRS, so we can build up and grow over time. And then when our trainees are learning this basic, standard, advanced level, we have another 5 milestones, so we start from 1 to 5, and the number 1 is you demonstrate what is expected for someone who is starting, and number 5, when you're like already beyond the target for your level, you're actually like an inspiration for others, and you're kind of like an expert in the field. We expect our trainees to reach level 4, so has advanced skills, knows substantially what they are doing, and that's this designated level for graduation. Level 5, not everyone will reach that level. We hope that everyone will reach that level. We also support a roadmap for clinical training. So for that, we divide in blocks, and that blocks we provide some guidance based here on color and grouping this site-specific rotations. So for instance, on the left, you can see, so yellow, the resident will be rotating on gastrointestinal, genitourinary, and gynae. And then on table 2 here on the right, we can show how a 5-day schedule would look like, mixing all the teams that you can build at your program. So here, how a training structure will be from first to third year. Every 11 weeks, there's a rotation, clinical rotation, and the residents will be able to rotate among different specialties. We provide this guidance here. You can change and make it unique to your department, but it's actually a guide so people don't need to spend time trying to reinvent how they're going to put the schedule together. And the roadmap, we want to achieve 2 things. We want that to be easy to implement, and we can help you to organize your entire clinic for your trainees. In addition to that, there's some other rotations such as oncoimaging, nuclear imaging, oncopathology, medical oncology, palliative care, surgical oncology, and all these other things that can be built up on different years. Here's an example, first, second, third, and fourth years, but it's just something for everyone to think about. And then the academic credits. Here's something that I feel that we can do better. We can do better. When I mean better, it's Canada, US, and Europe, and also Latin America. So we can be helping and supporting many countries with these basic modules on medical physics, on radiobiology, critical appraiser. For instance, we have just launched a new critical appraiser and methods research course from the Queen's University, which is open and freely available from anyone who is interested. And also here we list the clinical modules that you can be sharing with your colleagues from other specialties like palliative care, surgical oncology, and medical oncology. And this is just an example how you can organize the lectures and what kind of topics you need to be covering. I don't want to go over everything, it's very extensive. And again, we also provide for each of the roles that I provide to you guys an evaluation form. So how you can be evaluating your residents and how you can be grading them. So then you can promote them to the next level and you can understand how they are going on their career. In addition to that, I also feel that it's important for us to push for research and education. If you want to improve cancer control in Latin America. And then I have been working, and actually been working with Dr. Turner, trying to bring the Astro Leadership course to Latin America and host one session in Brazil. It has been challenging, but hopefully we'll make it happen someday. With Dr. Duma from Harvard, we have been promoting mentoring sessions and research sessions to a lot of residents all over the world and helping them with research, career advice, and etc. And there's also this big program discussing the needs and how we can improve mentoring of our trainees in Latin America. Okay, so I think I'm just on time. So this is my last slide. So really important take-home message is that this portfolio, and I'll give you guys the link, is freely available for anyone to download and to apply to your clinic. The portfolio is very interesting because we have all the forms, we have everything that either the trainers or the trainee needs, so you can download and you can use that in your clinic. That will help you to establish a competence-based program in your program and worldwide. And in the end of the day, we want to bring a solution so you can implement a standard curriculum that will be similar to other places in the world. So here's some more of my acknowledgements. And here's a free copy for anyone who wants to get touch to the portfolio and read it later. So thank you, and I'm open for any questions.